Hey friends, it's Susan from LegsLikeMine.com. I'm preparing for Lipedema Awareness Month this year, which is June of every year. And one of the things I wanted to do is just put a basic Lipedema 101 video up for you all and a blog post on LegsLikeMine.com. This is really intended for medical providers who may have a woman that's presenting with symptoms of lipedema, and they may even be coming to you with a pamphlet from the Lipedema Foundation or Lipedema Simplified, and they're asking for a diagnosis. And maybe you haven't ever heard of this condition. Maybe you're even a doctor who has in the past had women who've got these symptoms and told them to go lose weight, and you're looking to learn a little bit more because you've got more people coming in. So what is lipedema? So lipedema is a loose connective tissue disorder, and the way it manifests is that it builds up abnormal fat deposits in primarily the legs, thighs, calves, hips, buttocks. We see it a lot of times in the abdomen area, the arms, and some people even say that it's in their scalps and other areas of the body. When the woman comes to you, they may say that their fat is painful and they're fatigued. If their cat jumps on their lap, it hurts, and they bruise easily in these areas. And of course, there are reasons for all of those symptoms to be presenting. But when you palpate underneath the skin, it's just underneath the skin. In some of the areas that are affected by lipedema, you'll feel nodules that are the size of grains of rice, peas, all the way up to the size of, in my case, golf balls that were inside fat pads that were on the inner part of my knees. And women who have these fat pads, that's one of the telltale signs of people who have lipedema, is that the medial knee has got these weird fat pads that are there. Lipedema affects primarily women, and it affects approximately 11% of women. So in the United States, that represents about 17 million people who potentially have this condition. It is rarely diagnosed correctly. It's often diagnosed as simple obesity and lymphedema. And a lot of times, women who have lymphedema might be a late stage lipedema patient. Stage 3 lipedema turns into lipolymphedema. So, and actually the associations that certified lymphedema therapists subscribe to, LANA, they report that a percentage of their lymphedema patients actually do have lipedema as well. So some of the things to look for. There are simple diagnostic criteria for lipedema. They are not blood tests, and they're not right now scans of any kind. It is literally a physical exam and discussing family history and the person's history. Some of the things that you'll find out in the family histories of women with lipedema is that their moms, their grandmas, their aunts, somebody up the line had big legs like this. You'll find out that the woman probably has been on many, many diets. She may even eat well and exercise now. She might be thin. She might be obese, but it can affect all kinds of women with all kinds of behavioral habits, right? So diet and exercise do not affect lipedema tissue. Now, there may be comorbid obesity that goes along with it that can be reduced from diet and exercise or the GLP-1 drugs or whatever, but lipedema tissue doesn't reduce. It is just the cells are messed up to where they take in the fluids, and the adipocytes grow and grow and grow, but for whatever reason, they don't release the fluids out. So that's kind of what's happening at a super simplified level, right? So the Lipedema Foundation has information on their website. They have a clinician's guide for supporting women who have lipedema. Their website is lipedema.org. I have links to it all over LegsLikeMine.com as well. In all of my books, which are back here, I have QR codes that will take you to official, research-based information from the Lipedema Foundation. I highly recommend that if you have a woman that presents with symptoms like this, where she has abnormal fat deposits in her legs, her arms, her buttocks, any of those areas, and she just cannot get it to reduce despite probably years of trying different methods, right? You might look into lipedema, look at the diagnostic criteria, and what you need to know is that if she has come to you and she's done the research and she's bringing you a pamphlet about a disease you've never heard about, you need to listen to her. take a minute and don't just dismiss her with, you need to go see a bariatric surgeon or you need to lose weight, right? She is coming to you with a progressive disease that can steal her mobility and her mental health, right? So it's real. It's a real disease. The ICD-11 code for lipedema is EF02.2. And in the ICD-10 system, there's not one yet. But just know that at the global level, the disease has been recognized. There are global organizations that support this and a full network of people that are willing and able to support your patient with lipedema. Referrals that you might make include certified lymphedema therapists. You can refer or script for compression garments. Intermittent pneumatic pumps are great if it's not contraindicated for your patient. And obviously, they are going to need some psychological support, because dealing with a condition where you feel like a failure, where you've probably had some social stigma applied to you for years, right? They need to have some mental health treatment as well. So you can also refer them to surgeons. Venous specialists are typically more familiar with it. And there's a network of surgeons all across the country that are able to handle advanced cases and get your ladies taken care of, right? Get some of that fibrotic tissue that develops from being inflamed removed to help restore mobility and reduce the symptoms. The other thing that you need to know is that women who have lipedema, according to the Lipedema Foundation, go an average of 17 years of having symptoms before they finally get diagnosis in the United States. That is unacceptable. That's 17 years of suffering, emotional suffering, and disease progression. So we've got to get these ladies diagnosed. We've got to get it taken care of. If you have questions, go to the Lipedema Foundation website, lipedema.org. Go to LegsLikeMine. Get one of my books. Reach out. Don't just send her home and tell her she needs to lose weight, because that is the worst thing that you could do to someone who has a chronic condition and needs your help. All right, so that's Lipedema 101. I will be following up more over the month of June with more foundational information about lipedema. I'll have a whole video on the diagnostic criteria that's based off of the clinician's guide from the Lipedema Foundation. I'll have probably several other videos about self-management of the condition that you can share with your friends, your patients, and other people who have lipedema as well. So thanks for listening, and thanks for what you do. I know that it's really difficult to have so many diseases that haven't been taught in medical school, but believe me when I tell you, we're working on that. We want you to be familiar with the disease that impacts 11% of the population. It's a pretty big deal. All right, have a great day. I'll see you later. Bye.